Okay, let's start. Hello, ladies and gentlemen. We welcome you at our Thursday presentation. And the topic of today's short lecture is AKTOM. So, it will be a general presentation about application of this device. So I'm going to share my screen with you now. So let's speak about the EHF therapy and what is EHF therapy. It is a method of treatment when the body is exposed to electromagnetic radiation of millimeter range of extremely high frequency and low intensity. Membranes of cells in the body have their own frequencies within the range of 38 to 78 gigahertz. It is called extremely high frequency range. This range of frequencies connects all cells in our body into a single whole and allows us to maintain the state of health. So, as you see, the EHF therapy is quite multi-purpose kind of therapy because it can be applied in almost all spheres of medicine. It is widely applied in neurology for treating such diseases as headaches, osteochondrosis, vagovascular dystonia, neurosis, diseases and injuries of the central nervous system, and so on. The EHF therapy is applied for otolaryngological diseases, for example, rhinitis, sinusitis, rhinosinusitis, and otitis. It is widely used for treating diseases of pulmonology, which means that different diseases connected with lungs can be cured with these frequencies. These are bronchitis, pneumonia, but if a person catches a cold very often, the EHF therapy also helps. Then the diseases of dermatology can be also treated with the EHF, such as dermatitis, eczema, neurodermatitis, psoriasis, and herpes, and any other skin diseases. Also, diseases caused by infections and parasites are often treated with the EHF therapy. It can be opistrochiasis, hepatitis, severe acute respiratory syndrome, influenza, and so on. Diseases and injuries of joints can be also treated with the EHF therapy, for example, arthrosis and arthritis. But if a person has any kind of bruises and fractures, they also can be healed quicker if you apply the extremely high frequencies. The pain in muscles can be also treated with the EHF therapy, no matter what is the reason of this pain. Various pathologies of the musculoskeletal system can be also treated with the EHF therapy. This can be scoliosis or any kind of postural disorder. And the EHF therapy is also widely applied for treating gastritis, gastric ulcer, and duodenal ulcer, pancreatitis, and so on. What are the benefits of using the EHF therapy? First of all, it enables you to shorten the duration of the therapy, and it helps you to recover quicker, no matter if you use it in combination with other therapies as co-therapy or as a single therapy. The EHF therapy enables the patient to recover quicker. And so we can say that it also raises the quality of therapy because it makes the effect of any other therapy, for example, medical therapy with medicine, surgery, and so on, more efficient. It also lowers the cost of treatment because it enables you to reduce the amount of medicine you take, and in some cases even enables you to stop taking the medicine after some period of time. The application of the EHF therapy enables the patient to lower the probability of relapses. So it can be also used as a kind of prevention so that the patient doesn't get the same disease again. As you have seen, this therapy is really multifunctional. It can be used almost in case of any disease. So it's also one of the benefits of this therapy. And what is important, there are no allergic reactions to the EHF therapy, and there are almost no contraindications. There are really few. In this picture, you can see the influence of the EHF therapy on native blood. So the EHF therapy activates the existing resources of the organism and facilitates the adaptation and recovery processes. And as for the blood, as you know, the erythrocytes or the red blood cells deliver the oxygen to the organs and systems of our body. And when a person is young, we have a normal amount of erythrocytes. But when a person gets older, the concentration of the erythrocytes grows, the blood gets denser, and what is important, the number of dead red blood cells increases. So these dead cells stick to each other and create blood clots. The blood clots cork up small vessels and capillaries, and this is the reason of occurrence of thrombi. And as you know, the thrombi is the main reason of heart attacks and infarctions. So you can apply the EHF therapy to liquefy the blood, to break the clots in the blood, and to prevent their occurrence. So here on the left image, you can see the blood cells before application of the EHF therapy, and on the right we can see the condition of the blood cells after application of the EHF therapy for 10 days. As you see on the left, there are blood clots, and on the right, the erythrocytes are in normal condition. There are no clots anymore. And so the EHF therapy has helped to liquefy this blood. Now, I'll remind you that we have different kinds of EKTOM device based on the extremely high frequencies. The most often used one is this one, which is the basic EKTOM device, which has 11 different modes. We also have the EKTOM Mini, which has 3 modes. I don't have it at hand now, but it looks the same but a bit smaller. And we also have this EKTOM Air device. It has only one mode, the background resonance radiation mode. So as for the oscillators, we have 4 colors. The basic one is yellow. Each basic set of the EKTOM device now includes 4 yellow oscillators. And the yellow oscillators are most basic ones. They are multifunctional and can be used in case of any diseases because the range of their frequencies is quite large. It is from 4.9 to 7.1 millimeters. The other oscillators are meant for dealing with special disorders. The red oscillator works with the frequency 7.1, and its main purpose is to work with the immunity. When a person has lowered immunity, it can be used. For example, when a person suffers from long-term chronic diseases, or when the person has increased aggregation of erythrocytes in their blood, or ischemia. The green oscillator works with a frequency 5.6, and it can be used in case of erosion and wounds. And the blue one works with a frequency 4.9 and works with platelet diseases like ischemic heart disease, thrombophlebitis, and so on. These are just some most common examples. Of course, each oscillator has more functions, but the thing is that the yellow one is multi-purpose and other ones are used in special conditions. So now I would like to say a word about application of the EHF therapy in most common situations for treating disorders we face very often in our everyday life. First of all, the EKTOM is often used for treating pains. It can be any kind of pain, including the headache, and it can be pain of different origin. So when we are treating pain of any origin, we are using the red, the green, or the yellow oscillator. We usually apply it to the area where we feel pain. It can be head in case of headache or any other place. And we use the background resonance radiation mode, which is second mode of the EKTOM full, of the usual EKTOM, and the second mode of the EKTOM mini. The duration of treating the patient in case of pain is 1 minute of active mode, or after 1 minute the frequency of the painful place of this pathological area will be recorded, and you can just attach this oscillator to the painful zone and keep it there. You can also attach this oscillator to the reflexogenetic zone, the projection of a big joint, or to the area of accumulation of vascularization, like elbow, knee, large occipital opening, in the middle part of the sternum, or carotid arteries. In order to be able to apply the oscillators to different places, we put 4 yellow oscillators to every set of the EKTOM. So you can use a few oscillators at the same time. The EKTOM is also used for increasing immunity, which can, as a consequence, you can prevent the occurrence of diseases, and that's why people who catch a cold very often or suffer from different infectious diseases also use the EHF therapy. One of the reasons is improving the immunity. So in case of immunity, we work with the acupuncture points. There's a special mode in the EKTOM, which is the 11th mode. It is designed specially for working with the acupuncture points. The duration of treatment is 6 to 12 days, and the time of application every time is 9 to 15 minutes. As for the regime of treatment, we can do the following. For example, we can apply the oscillator on Monday, Wednesday, and Friday to points GI4, E36, and I12, and to 3 other points on Tuesday, Thursday, and Saturday. So we can do it in turn. We can apply the oscillator in turn to different areas. As for the acupuncture points, you can see them here. So here is the GI4 is here on the hand. E36 here. E36 is on the leg, and I12 or BC12, it's here on the sternum. So, and the rest of the points are here. MC6, it's well, anyway, you can see these points here, and you can apply the oscillator to 3 special points during 3 days of the week, and to 3 other points during other days of the week. According to your condition, to how severe it is, the treatment can last from 6 to 12 days. Another very common area of application of the frequencies is application of it for treating different kinds of otolaryngological diseases like rhinitis, sinusitis, or RV. So the mode which we use in this case is background. Is the second mode, background resonance radiation mode, and the oscillator is yellow again. So we record the frequency of the maxillary sinuses, which is here on the side of our nose, and then apply the oscillator to the wrist and keep it there for 1 minute. So Basically, it's like this. You put it here and then apply it to the wrist. Then the ectoderm is also often used for treating the diseases of the musculoskeletal system, any kind of diseases. And the main effect, it can be explained by the analgesic effect of the EHF waves. So you can reduce the pain you feel while suffering from these diseases. And also its immunostimulating and regenerating effect. The EHF therapy can be used for treating such diseases of the musculoskeletal system like osteochondritis, arthritis, deforming osteoarthritis, and also different lesions of small joints and on the feet and hands. As for the regime of treatment, in case of these diseases, you can apply it to the sternum area and to the joints. But most of the time we apply the oscillator to the sternum area, to the joints most of the time, 2/3 of the time, and 1/3 of the time we apply it to the sternum area. So here you can see the zones where you should apply the oscillator in case of the diseases of the musculoskeletal system. Here. So the duration of treatment is 10 to 20 days. At the time of application of the oscillator each time is from 15 to 20 minutes. It depends on how severe the disease is, how acute the symptoms are. And another interesting method of treatment is the so-called 3 paths method. It is a method of treating pains in the spine. In this case, we use the blue or the yellow oscillator, and we work with the mode 1 of the basic ectoderm device. As for the regime of treatment, we apply this therapy for 1 or 2 times a day for 5 days. After 5 days, we make 2 days break, and after that, repeat it for 5 days, then do 2 days break again. And the duration of the whole treatment should be 3 weeks. So as for the procedure, it is the following. We start at the occipital hollow. We put for example, the yellow oscillator there in the first mode of the basic ectoderm or the 3rd mode of the ectoderm mini. So we start here on the occipital hollow, and we move the oscillator very slowly for 2 minutes. So in 2 minutes, it should reach this place. This is approximately 1.5 centimeters from the coccyx. So this is a very slow movement, which takes you 2 minutes. Once this is finished, you do the same on the right and on the left, so that you cross the so-called transverse processes here. On the right, when you do the same movement, and it should take you 1.5 minutes. After that, you do the same, but on the other side. And this is a very efficient method which helps you to treat any diseases of the spine, any postural problems, for example, or pains in the spine. So that's all I wanted to tell you today. These are the most basic cases in which you can apply this device, and you can do it at home. It's like a pocket medical clinic. So if you have any questions, go ahead.
I have a question for the arthritis or the back pains. First, like, when do you have a manual that comes with the ectoderm that's going to let you know what points to add it to or to place it for how long? Or these findings based on clinical trials? And if so, do you have those available so that we can learn with, more examples?
Would you like to get some information on the research which was carried out here? I can send you some very boring information, just some statistics, how the ketone was applied in case of different diseases. We have this information. Unfortunately, but I can translate it to you briefly so that you know. Like widely used in different for treating different diseases, and we have medical reports on it.
Yes, yes. And the second part of the question was, hello?
Yeah, I can hear you.
The second part of the question was, you mentioned for one of the cases you would put it on certain acupuncture points. Does the AK Tom come with that information to know which acupuncture points to use, or is that a separate thing that we have to obtain or learn?
We don't have it in the Aketom manual, but it is the common knowledge. So the acupuncture points are the same for all kinds of therapies. So you can, I have just shown you some schemes, send it to you, but there is a lot of information on the internet on the location of the acupuncture points. So we work with the common acupuncture points, which are generally known, nothing new. So if you have any understanding of the acupuncture, it's actually the same. It's another kind of influence, but it's the same therapy.
For the musculoskeletal system protocol, what is the mode and what color oscillator do we use?
We can use the yellow one and also the blue one. And we use the first mode if you have the classical Aketom. I don't know if you have the classical one or the mini, but
first mode.
But you can use the one if you use this classical Aketom, the first mode.
Thank you.
You're welcome. Any other questions?
I have a question. Last time about AK Tom also. We were told that we can do for a maximum of 30 minutes each day. But in some of the suggested protocol today is like 1 minute. So 1 minute and 30 minutes is a big difference.
30 minutes is maximum time which you can use the oscillators in the active mode. So I mean, you can use you can wear the oscillator all day on the place of pain, but in the passive mode, in the background resonance radiation mode. But the 30 minutes per day of the active mode is just the limitation. You can use less, but not more.
What is passive mode? What is active mode?
Oh, yeah. I mean, there is only one passive mode, which is background resonance radiation mode. So, for example, you can use this Aketom Air, but also the usual Aketom. You just click on this button, and for 1 minute it's blinking, because for 1 minute the information is being recorded from your pathological cells. And after, so for 1 minute it is active. And after that, it stops blinking, it stops producing the frequency, but it emits the frequency of your cells, which it has recorded. So in this mode, when it doesn't produce its own frequencies anymore, but it repeats the frequencies of your body, I call it passive mode, just to make it easier. So in this mode, you can use the oscillator for all day long and nothing bad will happen. But in this active mode, when it produces the frequencies, it can be used up to 30 minutes per day. So any other mode except for this second mode is also limited by 30 minutes per day.
Thank you. So the basic mode you mentioned is the BBR, right? The passive mode is the BBR.
Well, the background resonance radiation, yes, it is one of the basic modes. Just other ones have other purposes, but this one records your own frequencies, or it records the frequencies of any other object. So this is the mode which every AKTOM device has, including this one.
What is the thing you're wearing on your wrist?
This is the AKTOM Air. It is this device has only one mode, this background resonance radiation mode. So it is the simplest version of the AKTOM, and it is mostly used also for different purposes, for killing pain, for increasing your immunity, and also for protecting yourself from the influence of electromagnetic fields. So it is just a device you can wear every day for your everyday protection. It is the simplest version, which is the most convenient to use.
Can you set the frequency, or the frequency is set?
Well, here in this case, there's no set frequency, but it works with your own frequency. So it records the frequency of your body. In other modes, the oscillator emanates special frequency, but in the second mode, or in the background resonance radiation mode, it records your frequency. Understand?
It's a very interesting device.
Oh, it is.
AKTOM.
Say it again.
We got the AKTOM, but do not have the blue thing. How expensive is the blue thing?
The AKTOM Air. Yes, it's not only blue. We have it in other colors too, yellow, and red. But it's just the design.
We cannot hear the dollar amount. It's very broken. Can you repeat again how much that is?
So we have this bracelet in other colors, in red, in yellow, and in black, and in blue. But it's a question of design. It doesn't have any difference. But if you already have the AKTOM, the regular one, this means that you also have this mode. It is the second, the background resonance radiation is the second mode of this AKTOM. So actually you can achieve the same effect by clicking on the second mode of this AKTOM device and on attaching the oscillator to your body. Just this watch is quite convenient to use in everyday life. That's the only difference, but the effect is the same. The oscillator which is inserted here is this basic yellow oscillator.
I think this is a very versatile product, and I think it is more easily marketable than AKTOM, because if you just focus it on protection from the electromagnetic radiation, this function alone, I think it is makes it a very marketable product.
It's true. It's true. It's just, it looks cute. It's convenient to use, really. This one, the basic AKTOM is actually a medical device which you can use. It's more professional. You can use it to treat diseases. And this one is more for protection, for feeling comfortable in everyday life. And yes, it's a great thing.
Know how much it is?
Yeah.
It's around 30. You will find all information about the prices in our online store, gdvplanet.com. So we always put actual current information there, including all discounts and special offers. So it's better to check there. Yeah.
Thank you.
You're welcome.
I have a question about the life of the device. Does it stop working after a certain amount of time? Do you need to reset it, or is it kind of like the translators that as long as they're not broken, they will work?
Nothing will happen to it if you don't damage it physically. It just sometimes you need to change the batteries because it has a battery inside. But the oscillator will function. Nothing will happen to it. Срока годности нету. It will. The influence will be. Oh, yeah, you shouldn't put it into the water, for example. If you put it in the water, it can be damaged. But just any electrical device shouldn't be put into the water, but the oscillator too, it shouldn't be put into the water. I think we had some case when one of our clients had a dog and the dog bit the oscillator, so it stopped working. So if you physically damage it, of course it might become defected. But if nothing happens to it physically, it will work even in many years. Okay, any other questions?
Now,
Okay, can I say that in general, the bracelet help support a person's energy system, and because of that, it kind of will support the person's immune system, and enhance the overall well-being of the person. Can I say this is the function of the bracelet?
Yes, that's right. That's exactly what it does. It improves the general well-being. So people who suffer from headaches say that they don't have the headaches anymore. People who suffered from colds say that they don't catch a cold very often anymore, and if they do, they recover quicker. So this device enables you to improve your immune system. And also the protection from electromagnetic field is an important function. Of course, it doesn't prevent you from getting the influence of the electromagnetic field, but it helps you to fight with the bad consequences. So yes, it is just for improving the quality of your life, for making you feel better in your everyday life.
Two more questions. Number one, are there any scientific research to support the use? And second question is, if a person is sick, can they wear it?
Yeah, so as for the first question, are you interested in the scientific explanation of the mechanism, or in manuals how to treat particular diseases?
Both. But one more thing is, a lot of people will say, do you have any evidence to support your claim? So are there any clinical research to show the effects or the benefit of the bracelet?
Yes, there is. The bracelet is based on the same frequency, the same background resonance radiation mechanism, which is used in other EHF devices. But as for the research, there was a lot of research which proves that this technology works, that the EHF therapy treats different diseases. But as you know, the bioresonance wasn't recognized yet scientifically, because we know that there is this influence, that there is this effect, a medical effect, and it's proven, but there are still discussions on how this mechanism works. That's why it's, as for the explanation how it works, there are still different hypotheses, and it's still not, there is still no one explanation. But as for the research regarding the effect, it is proven, and there is a lot of research. If you want, we can send some materials to you. And the second question, what was it? Remind me, please. Annie, you asked the second question.
Yes, our question was, can it be used by a sick person, any kind of sickness?
Yes, yes. Usually it can be, there are almost no contraindications, so the ketone can be used for sick people too. It's actually used for different illnesses. Just there are some contraindications. For example, if a person is in a very unstable state, if it's some disease is in an acute state and it is not very, it's not stable and it's not very clear what's going on with the organism, because when and in case of very serious diseases which threaten the life of the person, it is not recommended, because when the organism has no energy at all, most probably this technology will not produce effect. The organism needs to have some energy. So in just some acute, very acute situations, in them it is not, it is better not to use this device. Also, pregnancy is kind of a contraindication, but it is in Russia, actually in Russia it is used for pregnant women, but in the European Union it is more complicated with the laws. That's why here it was not recognized for treating pregnant women. So it's also kind of a contraindication. At least it's recommended to be careful in this case.
Can I ask one more question? If it is all about frequency, can I attach it to a glass of water? And will the glass of water be affected by its frequency? And if I drink the glass of water, will I benefit from it?
Yes, exactly. You can. The ketome is used for structuring water, among other things. So in this case, we use the same mode. We can use the actually the ketome is also okay with it because it's the second mode. But other modes can be used too. So yes, the ketome, you can just put an oscillator near the glass of water or near the bottle of water, switch on this background resonance mode for 1 minute, and then keep it there for 10 minutes. And for during about 10 minutes, the water will be structured. But we also have a special device, which is a ketome activator. Next time we can make a special presentation about it. Actually, it's the technology is the same, but it is more convenient to use the device because it is attached directly to the bottle of water, and there is direct contact between the oscillator and the water, or any other liquid. Even food is being structured with the extremely high frequencies, and people, the users say that the taste of the water of any drink or any food improves after using the frequencies. They kind of help you to open the flavor of this food and drinks.
Sounds wonderful.
This is more, I think this is more subjective, if the taste has improved or not. But this technology is used widely for structuring the water. This is a fact. Even animals prefer to drink the water structured by these frequencies, or it is also good for watering plants. So it's good not only for people, but for any living beings. Yeah, and any other questions? Susanna, you want to ask?
Yes.
Because we're about to finish.
Yes, just following up on the contraindications, you mentioned already the pregnancy, which was one of my questions, but what about babies, and what about somebody who may have a pacemaker, like in their heart or anything internal? Can there be a dissonance or some kind of distortion there, or something that can cause a contraindication?
Well, it is. There are no contraindications for people with pacemakers because there is no such. It is a low intensity device, so there is no contradiction between the device inside the body and in this ketome device. It is used for people with pacemakers, and as for children, it is also used for children. So no contraindications.
So no minimum age required.
В инструкции не написано, какой минимальный. Marko, nevíš, jestli v nějakém manuálu je napsáno, že je nějaké...
Neviděl jsem zatím nikde nějaké zmínku o minimálním věku.
Yeah, we have no, even in manuals it's not written that there is any limitation in age. But even in case of pregnant women, it's not that it will damage them, it's just for prevention, just in case. Because it should be, the treatment to pregnant women is usually more careful. That's why nothing bad will happen. But it is said that it's not supposed to be used during pregnancy, just in case. So yeah, in manuals it's not mentioned that it shouldn't be used for children. It's okay. Okay. In last question, and then we will finish for today.
Okay, last question. Maybe me. Good evening. In the manual for Akatom, it is written something about the physician's compendium. Do you know where I can get it?
No, but we can check it for you.
Yes? That's all. Thanks.
Okay, you're welcome. Okay, let's finish for today. Thank you for coming, and we will welcome you at our next presentation next Thursday. We hope to see you again. So,
Bye-bye.
Thank you.
Okay, have a nice day. Bye.
Bye.
Thank you.